Why is domestic violence on the rise right now? And it is. About a week, 2 weeks after France put in the restrictions, 30% rise in domestic violence. Domestic violence is on the rise on steroids in every place that there is restriction, isolation. Well, if you had a bad relationship before, now it gets exposed. Anxiety is rampant, at this time. People are just at each other's throats. If your relationship was unsteady, tension, or if there's a lack of people who don't deal well with stress together, couples, they really have a problem now. So the family can be in disorder, could be disintegrating. There is a major increase in divorce now. And domestic violence, for sure, is on the rise. Now, why? When you think about it, people are so restricted and isolated at this time. So what's happening is that people who really are not really adept at solving conflict, and they have histories of abuse either in their past or in the past in relationships, then what happens is there's just an escalation in that behavior, that controlling behavior. It could get so bad that that wives could feel like they're prisoners. It could escalate out of control. There's a rekindling of all kinds of old abuse. So, and this is happening worldwide. It just isn't one culture. The Chinese talked about it early on, before we had our lockdown. And now it's like an opportunistic infection. So in other words, if our bodies are worn down, then bacteria, other organisms can be opportunistic. And that's how this is, this whole thing about domestic violence. I do see this in my practice. It's not the happiest part of my practice. Really, the experts are now terming this intimate terrorism. Let me give you an example of this lady, okay? So I have a patient, a young fellow. Both these parents send me their kid. He was about 14, 15, highly acting out. And recently, one day, he says to me, "Oh, doctor, this is before this pandemic. No, this is around this time. He was on alone with me. And he was telling me, doctor, he beats her. I know, I hear it at night." I said, "Well, can I see your mom?" Because I've seen her before. And then I started to see her. And basically, there are very little resources now around the world for this. Resources are totally drained. Hotlines are totally drained. So she and I started to talk about how she's going to escape. And she has a place to go, secret, and she's going to wait until he leaves and then escape. And she did, with him, with the kid. And this is going on all over the place. So that was pretty unnerving. And there's a bunch of these things in the practice now. Well, the idea here is communication. That's really what is the essence. If people can communicate, when two people are in a marriage and not doing too well, it's really difficult. But it would be best to communicate if you can. But basically, we're talking a long-term history of either the perpetrators' abuse issues that they had early on. And now, because of this situation of the isolation, it's like sparked it, and it's spiraling out of control. So, we like to give some easy fixes, but I think if somebody is in a relationship and they notice that they're being coerced, and what does that mean? It means that you feel like you're kidnapped. You feel like you're somebody's child. You don't. It's like being in a police state. You have no free will. You have to do what he says, and that's what the relationship's about. It's like what you should do or not do is up to the perpetrator. So, what do we do? I think really the best situation, if you really find yourself in, is you got to get the hotlines. You got to tell people. You got to don't be isolated and let yourself be isolated. And the way things we would like to get couples to get along, I don't think it really works here. I think we've crossed over the line. Okay, how could an abuser who knows that he or she feels that they're hurting somebody, they're concerned about hurting somebody, and they don't really want to act out? That's when it's good for that person to reach out. Reach out to some good friends, some people that you could trust, and see if you could get some professional help. Because that is the kind of individual that may not become so abusive. And there could be some interventions in the household, at that point before it reaches, the stage of physical violence or other kinds of coercive behaviors. What the kind of things that we see for people in these kind of situations is they become so controlling that some of their tools, I'd like to mention, because this is what we see in the abuse. Well, not all people who are abused are physically abused. It could look differently. It could be economic, financial abuse that way. It could be emotional abuse. What tools do they use? They use isolation. So right now we have a setup in this pandemic for isolation, because you have to be isolated, and the amount of cases are going up geometrically. These people put their victims on constant surveillance. They have rules for behavior for the individual. The rules that encompass their food, their clothing, and even their sanitary facilities. So it's a horrendous situation when it gets to the point that we're talking about. My final advice is that domestic violence, and the new term that experts are talking about is intimate terrorism. Intimate terrorism. That's quite a mouthful. And what we're talking about is that this really requires immediate intervention. Don't let it go on, or it could lead to very serious consequences. When you see the tools of the abuser really starting to take hold in possible physical abuse, constant surveillance, strict rules of behavior for the person who's being abused, even so all the whereabouts need to be told by the abuser, then it is time to get help, and certainly even before that. So try to contact the abuse hotlines, get involved with friends that care, and get some help immediately.
BregmanMD Medical Group offers online psychiatry and online therapy.